started. Today's a special day. This is a memorial lectureship for Dr. Don Fournier. Don was a clinical faculty member for a number of years. Actually, he was an allergist immunologist who practiced up in Texarkana. But he had a strong commitment to education and a strong commitment to giving back, and he was an excellent teacher. So on his own, he would come down here on Fridays to run the allergy immunology clinic for the fellows, the allergy immunology program. And he did that for a number of years. Unfortunately, he died at a very young age. But his legacy is the people that he helped train. Actually today we're very lucky because one of the trainees who is our graduate from our program is going to give this presentation. But after Dr. Fournier died, his family and friends put together a fund to create this memorial lectureship. And so we're very proud to produce this, have this every year, and have had a series of excellent speakers and who have provided us with a presentation in the field of allergy immunology in his honor. So I think it's a real pleasure for us to do that, and a real great thing to have Dr. Hedberg here, who will have a more formal introduction by Dr. Bonnet. So, Sammy, let's do something.
Thank you very much. Well, it is a very special event today in many ways. First, the memory of a dear colleague who passed away, who served very faithfully as a volunteer for many years here. And also because of the special speaker, I say special with emphasis. We usually get the top academic professors who do a lot of research in labs and publications, and they have their stature, but also the speaker today have his own special stature, as you will see now from his achievements. Thirdly, the topic is very important about the management of asthma and allergies in schools. All pediatricians have to know that. So it is always I give a few words about our honoree, Dr. Fournier. That he was graduate from the University of Texas in Galveston, internal medicine residency and allergy immunology at Wilford Hall, U.S. Air Force, and certified by both internal medicine and allergy immunology. He was a member of numerous societies. He's one of the most active clinicians to be in societies in Louisiana and Texas, the American College of Allergy, Asthma, Immunology, American Academy, the Joint Council, the American Medical Association. Not just paying dues, but he was active there. He's a member of the editorial board of Allergy and Asthma Proceedings. Even the clinician can be an academic clinician and can review articles and be a referee for this. He was retired as Lieutenant Colonel, and in addition to his solo private practice, he actively participated in many scholarly activities and at the state level of Texas and Louisiana as well as regionally. For many years, he served on the program planning committee for the Southwest Allergy Forum and the Eastern Allergy Conferences. There were 2 conferences a year by these organizations. He was president of the Texas Allergy, Asthma, and Immunology Society, and was the governor of the region, of the regional state and local allergy and asthma immunology for this region. I don't know how it has jumped few slides. So we go. So Don, as Dr. Bocchini mentioned, he was a volunteer clinical faculty here at the program, contributed significantly to the allergy immunology training program for 20 years, driving the long way with remarkable dedication, absolutely. He was just committed. He passed away after a short illness on February 9th, 2008, at the young age of 58. So to commemorate his contributions, the Allergy Immunology section established an annual memorial lectureship in his honor, and our speaker was very instrumental in initiating and establishing and maintaining this lectureship. So the speaker is a friend, not just a former trainee of Dr. Fournier's and mine, but it is a pride for me. So he's a true friend. Whenever we meet, we had a great time in there. Dr. Hedberg graduated from the Missouri, Columbia. His residence in internal medicine at the University of Arkansas. He practiced general internist for a few years, for 9 years, and had fellowship in the allergy immunology in the program here. So after solo practice successful, he just transferred himself and his family to come to be a student again, and he performed wonderfully. During his fellowship, he served nationally as a mentor for residents and students at the national meetings at the American College of Allergy and the American Academy of Allergy. He's certified by both boards, internal medicine and allergy immunology, as a fellow of the respective organizations. And he founded, after his finished his training, again solo on his own, founded his Asthma and Allergy Center in Rogers, Arkansas, which expanded to be 2 places by now, with 3 partners already, and that it is a remarkable accomplishment. He's performing a true academic clinical practice, so he volunteers as adjunct faculty member at the University of Arkansas Medical Sciences, and he has, during his fellowship and afterwards, did several research projects, presentation, publications. He was just one of the exemplary fellows of this program. He is my first fellow in this program when I came, and I just admired him markedly. He extended, in spite of his busy practice, extended his service to the community as a camp physician, as member of the Central United Methodist Church, medical director of the Food Allergy Support Group in the Northwest Arkansas, and the American Lung Association Asthma Educators Program, the medical advisor of the Bentonville Public Schools, medical director and sponsor for the Food Allergy Research and Education Awareness Walk in his city. He's a physician representative of the University of Arkansas School of Medicine Admissions Committee. He's among the best doctors chosen by his peers in his region by the AY Magazine Arkansas, as well as in the Arkansas Democrat Gazette. This is just a summary of an accomplishment of a practitioner, a solo practitioner, that how he can do both in a wonderful way and extend free services to the community around him. But he extended also nationally. I expected for him that he will be a national figure. And I think I am seeing that, and I am expecting more. For example, for the American College of Allergy, Asthma, and Immunology, he served in several committees. And he was so-called accused that he has too many committees serving on. The anaphylaxis committee member, program committee, which is an important, hard-working committee, moderator of several sessions at the annual meetings, is involved in a very tough committee, the CME committee, a chair of the recruitment committee, a chair of the, which during his years as on this committee increased the number of memberships well. He's the chair of the Environmental Allergy Committee, chairs of the Ethics Committee, which is a good committee also, and secretary-elect of the American College of Allergy Asthma House of Delegates. And he is currently on the Board of Regents, which is just a step before the high-up leadership. He will conclude this next month, but I'm expecting for him to continue going up. Please don't disappoint me, Kurt. No, I'm expecting definitely to go up there. There's just a few pictures of him with Don Fournier. There is a friend of his, and Michelle, his Kurt's wife there. And he used to have a nice beard there. I think he looked good at it. And that. Again, Don Fournier here, and the two of our trainees at his time, at the first time. And again, with some other fellows with Fournier. And whenever we go to a meetings, he's there in the center. So it is good to find trainees from different years. Just they belong, although they did not see each other during the fellowship, but they feel belong. So from the year 2003 graduated Kurt up to other years afterwards, and in 2013, 14, these two. So we gather always there. As I said, I'm expecting for, and mark my word, that Kurt will be one of the leaders nationally there. And behind every successful man, there is a special woman, of course. And Michelle is next to the man, always there, happy, both at his work and in meetings. It's always a pleasure. And as you see, the ribbons of Kurt are increasing there, and it will go down more. Yeah, so it is a pleasure that Kurt will be the speaker today about the important topic, management of asthma and allergy in schools. And please come on, Kurt.
Thank you. It's such a great honor.
It is a pleasure to give you this plaque for this occasion.
Thank you. This is just another slide showing our group here, Don Fournier and Sana. I think Sammy's looking at the belly dancer or something over there to the side at our graduation dinner. I'm not sure what was going on there. And Dr. Peter Boggs and Burgess Chinoy and John Moisetis over there. So great times back in these things. And I think today that this little quote is quite good for this presentation. The mediocre teacher tells, the good teacher explains, the superior teacher demonstrates, the great teacher inspires. So actually I found out that William Ward is a Louisiana native, so kind of cool. I don't have anything to disclose as far as speaker or pharma relationships for this presentation. So, excuse me, these are the objectives for today. Hopefully, by the end of this talk, you'll be able to describe in general the impact of the asthma and allergy on schools, to recognize the importance of an asthma or allergy action plan, and hopefully even have a little better idea of how to formulate one. And I'd like for you to be able to identify your role, whether you're a student, a resident, a faculty physician, and how you can help children in schools with their asthma and allergies, and maybe have a little more insight as to what's going on in schools. So just a few facts about asthma. Asthma, as you know, is a common childhood illness. There's 9 million children that, or more that have been diagnosed with it. It's a leading cause of school absences. In the classroom, there's at least probably 2 children in each classroom or more that have asthma. Asthma is on the increase. We've seen huge increases in asthma over time. And you can see down here at the bottom, I apologize for you in the back that may not be able to see it, but in the year 2000, there were about 4.6 million children that were seen in physicians' offices for asthma. There were about 728,000 of those who had trips to the emergency room, with about 214,000 that were hospitalized due to asthma. These are some statistics that I found from the Department of Health for the state of Louisiana. And as you can see, they're similar, although the risk of death seems to be higher in patients with asthma in Louisiana than it is nationwide. And Louisiana falls in the top 25% of states with asthma death. 200,000 adults in Louisiana suffer from asthma. So you can see there's still a problem there in the adult age. And 1 in 10 Louisiana households has at least one child with asthma. Girls are at higher risk than what the men are, and African Americans are more likely to have asthma. I think that's kind of a trend nationwide. Asthma severity can depend on the burden of the health system. So it's important for us to try to make sure that we have open avenues to be able to get people in so that we can take care of their asthma and take care of the exacerbations and do education. Food allergies. About 5.9 million children have food allergies. That's from a publication in 2009. 18% of these school children have food allergies. About every 3 minutes, somebody goes to the emergency room with an issue that involves food allergy. As you can see, there are a lot of ambulatory care visits every year. Teenagers and young adults have some of the worst problem as far as food allergy is concerned. Individuals with food allergies who have asthma are at higher risk of having a severe outcome from their food allergy. And the symptoms of anaphylaxis can be variable. I think one of the things that I've found in private practice is that there seems to be so many individuals that think that food allergy should present the same way each and every time, and it doesn't, okay? Many times there may be no reaction. At other times there may be 1 or 2 systems that are involved, and at other times it may be something severe or fatal. So please keep these things in mind. It is possible to have anaphylaxis without any skin rash, and I've seen that in my practice. I've seen this happen with other individuals. Matter of fact, especially in the allergy clinic where we're giving allergy shots, many times people don't have any skin manifestations at all, and it may just be respiratory or cardiac issues. So, of course, it's important for you to be able to treat anaphylaxis promptly. The earlier you can give epinephrine, the better the outcome, and the less problems that the person will have. This is very important to be able to recognize anaphylaxis early. So we're going to talk mostly today about IgE-mediated symptoms, but I want to make sure that you kind of have some of these ideas as to what may be happening. The GI tract, nausea, vomiting, diarrhea, you can see all those things. Cutaneous symptoms, I think those are pretty obvious. Most people recognize the cutaneous symptoms. Respiratory, sometimes just rhinitis. Sometimes we'll have dyspnea or hopefully not laryngeal edema associated with the situation. And then certainly when we have hypotension, tachycardia, those are also very strong situations here that could lead to death. Other symptoms that may occur may even be genital urinary symptoms like cramping that would occur during a menstrual cycle. So some individuals will report that they have menstrual cramps during an anaphylactic reaction. So this is the big thing. Many of you probably get a lot of questions about food sensitivities and food allergy. You know, the thing that I hate about the allergy term, or the lay term of allergy, is that everybody lumps sensitivity, irritation, whatever into the term allergy. And it's very concerning at times. I think there's a lot of misinformation that's out there regarding food allergy. Even Googling food allergy, you get all kinds of stuff. A lot of things do involve food sensitivities. I'm worried, particularly for children. I have parents that will come into my office and say, I don't want my child to be gluten sensitive or develop celiac, so I don't feed them wheat. And and then I don't give them milk. I only give organic foods, or we're vegan. And I'm very concerned at times that kids may end up nutritionally deficient because they're not getting an adequate wide variety of foods. So this comes up a lot in school, because you're going to get notes, you're going to get questions from school nurses and from administrators. Does this child need to have a restricted diet or not? And one of the issues, particularly in public schools, is that the schools have the duty that they need to make sure that the child gets a nutritionally adequate diet. So many times they're going to ask for documentation or medical information that relies on the physician or the direct healthcare provider at that time to be able to provide restrictions and suggestions for substitution. And I'm going to show you some of these things here in a little bit and show you kind of how ridiculous some of this stuff can get. But at the same time, I want you to understand what's happening from the school's end. If they have a parent that comes to them and says, my kid can't have anything with gluten in it, what kind of a challenge that actually makes for the school. If any school that gets federal funding has to be able to provide an adequate substitution for a child. So if we're limiting wheat or gluten, we need to make sure that they get a cereal substitution. Or if we're limiting meats, we need to make sure that there is some kind of adequate protein substitution for these kids. And I think that's very hard. I don't know about you guys, maybe you're getting better training to be able to tell people what to do from a nutritional standpoint, but it's very difficult. At the same time, if we have an individual that has a peanut allergy, well, to me, that's real simple. You don't have peanuts. There's no substitution. It's an avoidance, okay? I don't know what's going on in Louisiana, but most of the schools in Arkansas these days do not serve any peanut products whatsoever. No peanut oil, no peanut. Occasionally they'll have peanut butter for kids that forgot to bring their lunch. A lot of times now they're using soy butter or sunflower butters, but we'll have this in a different place in their cafeterias. So I tried to construct a chart that shows a little bit about food sensitivities. To the left, you can see the immunological issues, and to the right are the more either non-immunological or secondary food sensitivities. So sometimes certain GI disorders will cause a secondary issue regarding a food allergy. An example might be if a child has a gastrointestinal illness and they've sloughed the gut, and afterwards they eat shrimp and they break out in a rash. But then later they may be able to eat shrimp and not have any problems at all. So it may be the loss of the mucosal protection that would provide the situation, or even another food. So, and then certain drugs can do the same thing, especially ones that may have a direct effect on the GI tract. So from a non-immunological standpoint, these are the things that would be things like food poisoning, sensitivity to food additives like MSG or sulfites, histamine toxicity that we would see with scromboid poisoning, and then our lovely gluten sensitive enteropathies, which would be the celiac sprue or gluten sensitivity. Down here, this is kind of hard because from the immunological standpoint, we do have IgE-mediated situations, and then we've got this mixed bag of either non-IgE or mixed reactions, but a lot of the ones that are there in green are actually things that are more delayed. Probably the thing that you're going to see the most in this category would be the atopic dermatitis. An IgE-mediated situation, but a chronic illness that causes pruritus and rash, and that we see very commonly in children. The oral allergy syndrome, hopefully some of you know about that, but this is a situation where when you have allergy to certain things, for instance, a pollen, it may cause some oral sensitivities, a little bit of itching in the mouth, maybe some throat discomfort, occasionally abdominal symptoms. Examples might be if you have a birch pollen allergy, then when you eat a fresh apple or any kind of a stone fruit, cherry, pear, plum type of situation, you may have some discomfort in your mouth. Usually when we skin prick these individuals, you don't see anything, but they report these issues. And sometimes with immunotherapy, the symptoms get better. But it's not really dangerous, but it can be kind of scary for the individual. The treatment is avoidance. So, allergy other than food. About 15 to 30% of people have allergy to animals, particularly cats and dogs. It's estimated that at least 10 million people in the United States have a cat allergy. This is something that seems to be coming up a lot recently in schools, where we have companion pets, service dogs, or therapy animals. And I don't know whether or not you guys are hearing these things, but I hear things like, oh, well, the shelter brings in cats and the children read to the cats, or we bring in therapy dogs and they play with the children in the schools. One of the anaphylaxis committee from the Academy of Allergy contacted us all once and wanted to know our opinion. This is a few years ago. There was a situation in Florida where a child was peanut allergic, and the parents were demanding that a peanut sniffing dog come into the school. And so my first comment was, what are we going to do for the dog allergic children? So other significant allergies, certainly cockroach, mold, rodent allergens can be in our schools. I kind of went to the internet and found some funny things to show you all here, and I'm going to go through some of these things and show you that these can be real issues. But I'd like to give you sort of a summary of some key findings. This is from the Journal of Allergy and Clinical Immunology. Exposure to indoor animals in daycare and school environments. This is really one of the best summaries that I could find regarding allergies in school that did not involve foods, okay? And it might be small for you guys in the back. I apologize for that. Certainly daycares and schools have issues, and this is common. Allergy can vary from the time and location. As you can imagine, probably even the season. Of course, during the times when there's more kids in the school, there may be more issues. We have pet dander that sticks to people's clothes and their blankets and all the things that come into the school, as well as maybe even some rodent antigens that may come in and out. Schools and daycare facilities have been known in many studies to have extreme levels of things like dander, sometimes mold, and rodent antigens. So certainly carpeting and furniture, things like that are going to be reservoirs for allergens. I had a situation one time where I was called into a classroom. One of my patients kept having coughing every time he went to his science class. And I went and the teacher told me, we've taken everything out. We had been doing some forestry type work, and we had wood and leaves in here, but I've moved all those out, and the kid continues to cough. Well, I went in there, and she had a deer head and a bear head or something on the wall. And I'm thinking, well, maybe that's the issue. And then I went over to the window, and this is a brand new school, and they'd done some construction, and there was mold and dirt all around in the window. So, I think some of these things may be valid. Of course, parents kind of get on their high horse about some of these things at times. And then there are also other parents who probably should be on their high horse about it, and they aren't, and the kids suffer at school. So the relationship between allergic respiratory disease and indoor allergens is quite high, as you know. There's quite a strong connection in many individuals between nasal symptoms and what goes on in the chest. When this is inflamed, so is this. We have lots of published data that shows all of this. Environmental control, remediation, and interventions, this is difficult. We had a situation in Bentonville where the old high school that turned into a middle school was found to have bats, guano, and mold in the roof. And they called me and said, what should we do? And I said, well, the first thing you don't need to do is alarm everybody, otherwise you're going to have everybody up there in your office. I think that you just need to get somebody out there, assess the issue, and try to get it cleaned up. There's so many of these things at times that can cause more problems than others, and obviously it was a health hazard and needed to be cleaned up, but the issue of informing everybody and before we have all the facts together and causing lots of alarm and alert are not always the best way to approach things. So dogs, in the service dogs in the school. I thought this was kind of interesting. This is from somewhere in Ohio. And it was a 6-year-old child who had autism. And her school teacher had a dog allergy. So it was an issue and a little bit of an argument between the parents and the school as to what was going to be done. The parents wanted her to continue to go to the same school. Apparently there wasn't another option there. So finally, along with their attorney and the school board, they were able to actually intervene and found they were going to wait a year before the kid went to school and was able to have a teacher that wasn't allergic to dogs. We've seen these issues before as well. You know, I've had situations where the teacher will say, well, I'm a diabetic and I need to have my peanut butter and crackers. Okay, well, you know, these are big problems, or could be big problems for students. So we have to be aware of what everybody has, not just the students, the other students, but also the teachers. This is maybe hard to read, but apparently there's a website that tells in every state what the laws are regarding service dogs. And so a service dog in Louisiana is considered to be a guide dog, a hearing dog. It doesn't say anything about autism, and I know this is, or PTSD or any of these other things that I've been hearing that we're having service dogs for. Of course, you have to make accessibility for the dog, and then there's, the license fees are exempt, which is kind of interesting. And then there's certain things about who's responsible. Well, there's even things here about the trainers of the dog. The trainers of the dog have the same leniencies as the individual that owns the dog. If the dog makes a mess or if it damages the property, the owner's in charge of it. So there's several things like this here, but there's nothing that says, can you have a dog in a school? Okay, can you send a service dog to school with a child that has autism or PTSD or some special need? So I don't know if you guys have encountered these things or not, but my thoughts are if you haven't, you will. I thought this was really interesting. It's kind of funny in a way to me. So this individual, apparently one person who'd worked for the school district went to law school, and another person that had worked with her had been suffering from a lot of things that she thought was due to mold toxicity, including agitation, gastritis, abdominal pain, persistent cough, headache, skin rash, lung infection, et cetera, et cetera. And then, the other little lovely quote down here, I heard she finished law school, and I thought, who better? She knows the ins and outs of this school system. She's very fair. Yeah. I wonder how much she got out of the schools for this and how much the person got in compensation. But, mold toxicity continues to be a very controversial issue. I think there's still very little scientific data that show that toxicity from itself is a problem unless you ingest molds. Sensitivity due to the allergy or to the to irritation situations can exist. So it probably isn't healthy to live in some of these places that may have a lot of mold. Usually if there's mold, that means there's also a lot of moisture. If there's moisture, that means that there's a lot of insects and maybe rodents and everything else to go along with it. So it's something to keep in mind, but at the same time, I think many times can get a little out of hand as to how it's handled. Hopefully, we can prevent these kinds of things from happening where it becomes legal issues for our schools and undue alarm and alert for individuals. So this is another one that I found where they did rat, roach, and fly inspections in several New Orleans schools. 36 out of 82 public schools. They found live and dead roaches, rat feces, and let me see, I'm trying to, yeah, so, there's a lot of things out there that can exist in the schools. My thoughts are that many times in some of these places that the homes are probably worse than the school. And that's another thing to think about. We can't always blame a child's symptoms just on the school. It may actually be what's going on at home. So how do you manage these things? I want to talk about the importance of being able to identify those students, and that takes a team approach. You know, it takes not only you, but also your nurses, the school nurses, the administrators. Everyone needs to be able to figure out who these students are, and we need to make sure that they get the services that they're due. Action plans. Action plans are very important. Matter of fact, it's almost gotten to the point in Northwest Arkansas where many of them actually require this for students. So, and part of this is I think some of the efforts that I've put behind it. Many times kids will come to school to bring an inhaler. There's no directions. Sometimes it doesn't even have their name on the box or on the inhaler itself. Parents are like, oh yeah, he wheezes every once in a while, or she wheezes every once in a while, but you know, they really don't know what some of the triggering factors are. So it's good to have some things that are there and make the school nurses and the administrators feel better. Know your support team. Know who the school nurses are. Of course, this changes all the time. We try to keep an updated list. The administrators, it's important to have a relationship with them, and I've done some of that as you can see as we go through this. And you need to have a working relationship with the cafeteria workers as well as the janitors and the bus drivers. What is your role as a physician, a healthcare provider? And I'm going to show you a couple of our allergy and asthma action forms that we put together and how we've tried to make them efficient for us and make them work. So it's important to be able to have a team. It's not just the doctor. It's not just the school nurse. It's also the student, and it's also the student's parents that need to be involved. And we need to keep the communication rolling. Many times we'll get sort of the mad mother that will say, I am scared to death to send my child to school because of his peanut allergy. And you better use that EpiPen if my kid needs it. You know, I'm trying to, you know, these are some of the things that we hear. Sort of a mean, scary presentation. And I try to preempt that by telling parents, say, look, I understand your concern. I've had other parents like you. I've had other students like you. But going in and building a working relationship and making sure that the teacher, the school nurse, the whole team feels comfortable with all this is very important. Otherwise, it can actually be to the detriment of the child's care. And so keeping the child in mind by having and trying to make sure that there is a good working relationship between all of these individuals is important for the child's safety. So this is our most recent asthma action plan that we put together. Let me see if I can figure out how to use this thing. Is it, which side is it on? Okay, yeah, very good. Okay, thank you. So this is actually a PDF. And what we've done is we've actually even, when we're using peak flows, we'll put in the best peak flow here. And we've set this up to be able to calculate, to put in our values. So we have our red, yellow, and green zones. So all the nurse has to do is put in the best peak flow, hit this button, and it calculates it and fills in all the rest of these things. We've listed medicines in drop-down boxes for controller therapy. If there's other, if there's other medicines that need to be used, we can place those over in here. We have different rescue inhalers and how many puffs we want them to have in each situation. We have a box down here that allows the patient to carry their inhaler on themselves, and that's one of our new state laws. That's kind of questionable sometimes. It makes you wonder, is the student always mature enough or knows what to do? Some parents will ask that their student even carry this on themselves as a kindergartner or whatever. I think we have to make sure that the safety of of other students and be able to use some common sense there. It always needs to be in place. And then, the thing about this is, all the nurse has to do then is push one of the doctor's buttons, and we have an electronic signature that goes down here. And the nurses in our school districts now feel like that this is actually even like an order, and that's how we would like for it to be. So, for those of you who may have a lot of doing a lot of action plans or have a lot of children with asthma in your practice, this may be some type of thing that you may want to put together. Action plans can be found all over the internet, and they can be modified and customized for your practice. Some people may use other situations in here. Many times we have the situation in here too if they need it before exercise. So keep those things in mind and just try to make things efficient for your practice. We've done the same thing for the food allergy plan. We've used the basic form, and we're still in the process of trying to modify some of this stuff. Marking whether or not the student is asthmatic or not, has a student name. We make the parents give their information there. We store a copy of this in their chart, because if they're somewhere, whether it's at school or they're other babysitters, or the parents have to leave town suddenly and the in-laws are taking care of the kid, and they don't have a copy of their action plan, at least it's here, and we could even fax it. So these are just some ways to try to make things easier and more efficient, and hopefully improve the safety of our children. So what is the physician role? Well, we're supposed to be able to identify whatever disability or diagnosis is going on. I think it's important to be simple but very descriptive. And this is hard to do. Let me give you an example. Many times if somebody has a peanut allergy, even though they may be able to eat tree nuts, many times peanuts are processed in the same plant as tree nuts. So sometimes tree nuts will have peanut proteins on them, and you may want them to stay away from tree nuts as well. I think, as far, my personal opinion from the school standpoint, I always put peanuts and tree nuts, just because I'm not sure whether or not the tree nuts that they have are actually going to be free of peanut. And parents will say, well, why do you do that? And then I'll explain it to them. They're like, oh, well, that makes sense. So, at other times, it's another example might be like down here, foods to be admitted. This is sort of another example. Well, if you put dairy, what does dairy mean? Well, if you ask all kinds of people out there, like, oh, that means milk, but you can have cheese or you can have yogurt or whatever. Well, no, it doesn't. Does dairy include eggs? Yeah. So we get some of these questions all the time. So you may need to be a little more specific about whether or not it's all milk products, whether it's peanuts, tree nuts, those types of situations. Restrictions on diet and activities. I don't know about you all, but I want my kids to move. Okay? They need to not be restricted from any activity unless they're having an acute exacerbation. And hopefully that exacerbation, if it's that bad, they probably aren't going to be at school. But otherwise, they need to move, because if they don't move, they're going to get fat and they're going to get lazy. Okay? And childhood obesity is worse than all these things and just contributes back to this situation. The social implications of food allergy and asthma. We could spend a whole topic on this. This is a problem. And a lot of times parents are like, I don't really want my kid to sit at the peanut table. Well, what else are we going to do? Are we going to, we have to make it safe for your child. We have to make it safe for other people. But at the same time, if we put that child at a table and the kid's eating a peanut butter and jelly sandwich next to him, could he be at risk? Well, you can argue about that, and it may or may not be at risk, but sometimes we need to, if anything, be able to isolate kids without making it a big deal. One of the things that we've done in many of the school districts in our area is if they have to sit at the peanut table or the food allergy table, that they get to bring a friend to sit with them, as long as the friend doesn't have foods that they're allergic to, okay? So in the case of peanut, many times it's the friend has to eat the school lunch, okay? So that way we're pretty sure that they're not getting peanut. Foods to be substituted. Like I said, I'm not a nutrition expert, and it makes me a little angry sometimes when they ask me these things. Here's an example. This is from the Fayetteville School District. So I sent a food action plan for a patient who's allergic to peanuts. He's had anaphylaxis to peanuts, and they want to know what to substitute. What is his disability? Well, to me, this seems kind of silly to use this form. Oh, first of all, it's redundant too because it'll say student's name and it says patient's name. Okay. Is it different? You know, it's like sometimes nobody really thinks about these things. They don't really think about them from the standpoint of how these things really apply. Now, of course, if the student actually has a situation where they've got some other disabilities, I could see where this form would be helpful. But yeah, so I put the little torch over here, because I'd like to reduce the paper in my practice. So that's what I'd like to do is just burn it. But so I wrote, omit peanut and tree nuts, omit all foods containing peanut. No substitutions are available for these foods. Please consult your dietitian if nutritional or caloric intake are issues with this restriction. So I don't know what else to do other than say I'm not going to sign it. My experience, so I've been in Northwest Arkansas since 2003. Our state has had several different laws that have helped, and one of the things that I didn't put on here was that the Medical Practice Act changed, which was actually pretty good. In Arkansas, it used to be that you couldn't give a shot unless you were a licensed individual. And licensed individual was a physician, a nurse practitioner, a nurse. In some places, an LPN was restricted, depending on what drug or what you were giving, which impacted epinephrine. Physical therapist, occupational therapist, and I think X-ray technicians could give certain injections. So the Medical Practice Act changed, and it basically said that any individual could do almost just about anything, okay? Which some of those things may not always be great, but including shots. So individuals like medical assistants, or even a school teacher or an administrator or whatever could administer epinephrine. And this is I think this is good. Of course, all these things had to be done under the supervision of a physician, and a physician needed to grant them the ability to do these things. So it took away this argument, because we had a lot of arguments in the nursing board that said only an RN can give a shot at a school. Well, we have a lot of school nurses that are not RNs. Some schools don't have a nurse. So it became a big issue. So this took care of a lot of those things. The other things that happened was that and I can't remember the year now, we have Alex's Law, which details the need for schools to actually allow students to be able to carry epinephrine and asthma medicines on themselves. And usually this is middle school and junior high and senior high students. The elementary schools, sometimes we need to discuss whether or not that's really important, or whether we think that that's going to be a problem. Act 757, which is one of the more recent ones, allows a school nurse, or actually not even an administrator, to administer epinephrine to a public school student under certain circumstances. So in other words, even if a patient hasn't been prescribed epinephrine and it appears that they're having an allergic reaction, the law covers that. Back when we had the issue before of the argument back and forth whether or not it was going to require a nurse to be able to give a shot, we had the issue where I talked to one of the school board attorneys with Rogers, which I'm going to show you some stuff here, and he said, look, we're doubly protected. As teachers and administrators, they have a duty to make sure that a student is safe. So yes, they can give or do whatever they need to if they feel like that it's going to save a student's life. So the other thing that we're working on, which I think Louisiana has some of the same issues, is ambulances, and that should be EMS, to be able to cover and have epinephrine 1 to 1,000 on ambulances. So This kind of outlines, I'm just going to go through very quickly. You know, this is one of the things that we came up with the Rogers School Board, and they actually made this a board policy for life-threatening food allergies. So it outlined the parent and the guardian's responsibilities, the student's responsibilities, the school's responsibility, okay? Because so many situations the parent says, well, it's not my problem, it's yours. That's not true, okay? And it outlined what the school nurse would do. You know, the school nurse would, you know, be part of the team. She would conduct the training, he or she, and also do the individual health plan or the food action plan. And also what needs to be done regarding food service, that they be educated about cross-contamination, that they have special equipment or food trays that would avoid some of these issues. What the classroom teacher's role is. And then again, custodial staff as well as school transportation, because these were all issues. And this was approved back in June of 2006. So this was a good, I thought it was good, and I still think that this is an example of something that schools can do. So what's next? Well, I think even here you guys have a lot of school-based clinics, and I see that that would be a great opportunity for physicians to be able to work with these clinics in schools and actually be able to improve asthma and allergy care for students. One of the things that I'm working on right now, and I'm trying to get the Bentonville School District to do this, is to use our healthcare portal as a way and a mechanism to be able to submit action plans for food and for asthma. So in summary, the presence of allergy and asthma in our schools is high and rising. The use of asthma and allergy action plans is very important for the care of our kids. Clinic-based physicians and healthcare providers really need to be able to identify these kids, and hopefully you've learned what your role may be. And hopefully this presentation will inspire you to be able to help out kids that have asthma and allergies. And these are some of my references. And this is my motley crew, our little Razorback here and our Razorback signs. This is Dr. Adeswa Virginia. She did her medical school at UT Galveston, pediatrics in Louisville, and went to Wisconsin for her fellowship. This is Jenny Campbell, and she went to medical school at UAMS and did her fellowship, her residency there in pediatrics and fellowship in allergy at St. Louis University. And this is Dr. Matt Bell, who is medicine pediatrics trained at UAMS, residency at UAMS, and has recently joined us. So special thanks to all these folks down here. This is great. This is a great place, and it's an honor to do this talk. Thank you. I may have a couple minutes for some questions, I guess.
Yes, we're open for some questions.
Kurt, what is the obligation of a teacher to give an injection of epinephrine?
Yeah, so this is something that's sort of controversial when we've talked about this. We've had some teachers that will say, I don't think I could do it, you know, or, you know, I think I'd have to have someone else do it. In some of those situations, we've actually, when the teachers had that kind of a feeling, we've actually tried to see if we could find a different teacher for that child. But I think it is the teacher's obligation to do that in some respects, from the standpoint if they feel like that it's, or at least to get some kind of help, to at least call 911 if they felt like that their student is in trouble. But as far as actually making that person do it, I don't know that they have to. I would hope that they would want to. That's what I should say. But you know, it's important.
Do we have any data on how often that actually occurs? How often are EpiPens being used in schools?
I don't know. Do you know of any data? Yeah, the question is, do we have data of how often EpiPens are being used in schools?
I know we don't have data, but we can guess that Certainly every school will have some reaction. Some people, before the reaction happens, they are expected to give before the manifestations appear. And sometimes the parents blame the school that overused an expensive medication.
Yeah.
And on the other hand, if they wait, they are blamed also. It's either way. That's why I'm just sympathetic with teachers. They are teachers, not medical professionals, and the expectations of parents vary widely.
It does.
And if your action plan states upon the appearance of the following gift, that will help everybody.
Okay, yeah. Mm-hmm. I can say it seems like there is always, at least in the 4 major school districts in my area, it seems like I always hear of at least one case every year, and it always seems to be around a holiday party. Fortunately, some of this stuff is decreased in our state because Governor Huckabee, former Governor Huckabee, has limited the number of parties schools can have. I wish the health department would ban food in the classroom and make everybody go to the cafeteria, where it could be a little more controlled environment. But unfortunately, we have benchmark testing and standard testings and things where people are bringing in snacks, and there's food in the classroom, and to me that seems to be scary at times. Yeah.
I mean, maybe one teaching strategy especially with staff and teachers who are, sorry, I don't think I can do it, is, well, what if you needed to use a defibrillator on the child? Would you do that?
Yeah.
And the defibrillators are so easy now with, red, yellow, green, boom, kind of thing, that, it's about saving a child's life, and most of us would do that.
Yeah. The thing interesting about those defibrillators, because they compare adults to children, evidently adults will pause. A child who's in there will push that.
Oh, yeah. Uh-huh.
Yeah.
Another question is,
Yes.
can the school be free of any particular allergen?
I don't think that's possible. I don't know that anybody could say, that they are free of any particular allergen. I think it's not possible to say that 100%.
To claim
Yeah.
that this school or this flight is free of something, that's impossible.
Yeah.
So we should not use that label or ask these places to be like that.
I agree.
They have no control on everything there.
The same issue exists on airplanes. These are big issues. And can you ask for individuals not to serve peanuts or nuts or
Pretzels or eggs
whatever,
or
whatever. Yeah. It's very difficult to get people to comply, and many people are saying, it's America, it's a free country, I can do what I want. I hate to be that way, but you would hope that people would be considerate of the situation. But we've had cases where we had one private school that tried to be peanut free, and the parents threw a big fit. And I'm like, it's not going to happen. You can't do that. Yeah.
I always say that let us free the schools first of drugs and guns.
Yes, and then, that's probably more important. Very good. Good point.
Thanks a lot.
Thank you.